Good morning, everyone. This is Andy Reese. I'm sorry we're a little late getting started. It seemed that there were some issues with everyone getting logged in, some confusion apparently about our link. I do want to start. People may be aware that beginning Tuesday of this week, the data that we have is shared on the website, the coronavirus.dc.gov website. And so it's available publicly each day, but I'll provide you that data sort of broken down a different way as well. As of yesterday evening, there were 135 people supported by DDS who have tested positive for COVID-19. You may recall that a week ago I reported there were 86, which sounds like a pretty significant jump. The other thing I reported a week ago was that starting last week, the guidelines for testing had changed so that people without symptoms who were at high risk and had had a contact with someone who had tested positive could now be tested. And so what we see amongst the 135 who now have tested positive. If you compare last week to this week in the data, this week out of 135 people, there were 62 who have never been hospitalized for a COVID-related illness. Last week, that was 26. So, while that is a significant jump from 86 to 135, the vast majority of those are people who have tested positive but are being monitored at home. As of today, we have the 62 people who have never been hospitalized or being monitored at home. There are 19 people who have been discharged, who were hospitalized but have been discharged. There were 17 people who had died related to from COVID-related illness, and 37 people are currently hospitalized. So we'll continue to provide updates on that data and provide as much context to it as we can.
Okay, good morning, everyone. First question, does the mayor have people with disabilities included in the Reopen DC advisory?
So what I do see from reviewing the all of the people is that I don't recognize some of our self-advocates among that group. And what the mayor has done is put out a request for people to give the Reopen Committee input. And so for people who have access to the internet, I'd like to provide you with the, we'll type it in as well, but I'll read it out, which is the website where you can go to complete a survey to give input to the mayor, which one will also speak to the fact that people with disabilities need to be representing themselves on some of these committees, because the reality is when the mayor kicked off, and she did just kick it off this week on, it was Tuesday or Wednesday we had our first meeting. When she kicked it off, she specifically recognized the significant impact that COVID-19 is having on people supported by DDS. So she recognizes this population, but we need to make sure that she hears directly from this population as the plans for reopening DC are developed, because as we move forward with reopening, for people who are at higher risk, the reopening is going to take a longer time. And, it's going to be something that's phased in. And, while people are aware that our current stay-at-home order is in effect through May 15th, those orders are reevaluated based on the data that we have at the time. The mayor has authority from the council to extend that until June 9th, and she'll be making decisions about that as we get closer to May 15th, based on the data that we have for DC in terms of where things stand. And the DC is relying on guidance that was provided by Hopkins School of Public Health that was given to the governors about a framework for how you reopen safely. So in order to provide input via internet, you would go to https://dcgov.seamlessdocs, seamlessdocs.com/f lowercase /reopen committees. And R, O, and C are capitalized if that matters.
Repeat it.
So that is https://dcgov, DCGOV dot seamlessdocs, SEAMLESSDOCS.com/lowercase f/uppercase R, lowercase e, uppercase O, lowercase PEN, uppercase C, lowercase o, m, I, T, T, E, E, S. That is reopen committees. And you will find committee feedback that you can provide to the committee and indicate that you believe, and there is, in particular, there is a committee that addresses the issue of equity, which I am on, the director of one of our provider agencies is on, but it would really benefit from having a person who's actually a person with a disability who is directly affected by this. So providing that feedback will help make sure that we have good representation on all these committees as we plan for reopening. And just to be clear with people, the mayor has pulled together all of these people, which is a huge group of people. There are, I think, 12 different committees to develop the plan for reopening. The target date for reopening is going to be decided by the facts and the data on the ground. But the plan will be how things will happen when the city is ready. And when the city is ready will be decided by looking at the standards that are established in the Johns Hopkins recommendations about what factors need to be in place in order to begin the reopening. So in providing the information on the data, I'm sorry, I did not include our provider data, which currently, to date, we have had 109 provider staff who have tested positive for COVID-19. And going forward, I expect that we'll be able to provide data on the staff who have tested positive and have, what their status is in terms of whether they are now working, have returned to work, et cetera. And unfortunately, we have to date had 4 deaths amongst people, amongst provider staff.
How is DDS ensuring that residential providers are using techniques such as bulk ordering and community shoppers to minimize COVID-19 exposure by staff?
That isn't a requirement that we have put in place for the providers. Each of the provider agencies have developed their own mechanisms for their ordering, that some of them may continue to have staff go to, like Costco, to make their purchases. I do know that in the District of Columbia, there are requirements about going grocery shopping, the measures that are being taken that are for all of us to minimize the possibility of exposure to COVID-19. And so, you know, the providers are dealing with that, I expect, in the same way that all of us are dealing with it. I do know that we have had some providers where they have sort of sheltered in place, and in those circumstances, part of that sheltering in place was having deliveries and, you know, not having any interaction with the outside community.
Are there plans to test all DDA staff?
I assume that means all provider staff. So the testing to date, as I said last week, there was an update, and the update in the testing was that testing would be for people who are at high risk who have had an exposure. There is not at this time any plan to test staff. What there are, though, are a number of different measures in the mayor's order, including, you know, the requirements that when staff arrive, that they be screened, that their temperatures be taken, you know, that any staff that are ill are not to report to work, that staff use face coverings. So there are a number of measures that are being taken. The thing to keep in mind about testing is that it is a point in time. If you test negative today, first of all, and these are issues that I'm repeating that have been told us by the EPI staff at DC Health, one of the reasons that they're not using this mechanism in an attempt to protect people. One is it tells you what your status is today. Perhaps there is some percentage of false negatives. The fact that you test negative today does not mean that you will test negative tomorrow. One of the concerns that they have as well is if you test negative, you might have the false belief that you are negative, and therefore you might relax some of the measures that everyone needs to be taking, which is frequent hand washing, not touching your face, wearing a face covering, keeping social distance from people, ensuring that there is at least 6 feet between you and other people, and at this time, only going out to places when it is essential to do so. Essential includes getting outside when the sun finally returns and doing some exercise, just making sure that you're keeping a good distance from other people when you do so. But at this time, there is no plan for testing staff.
Please provide data breakdown by residence type.
So are you referring, so if you're referring to for the people that we support, I can tell you that for people who have been diagnosed with COVID-19, out of 135, 46 of them were in ICFs, 2 were in host homes, 5 were in their own homes, 23 were in rehabs, 58 in supported living, 1 is currently in a nursing home, and just so you're aware, the person in the nursing home was tested but not related to any current COVID symptoms, so they're healthy, but they are in a nursing home for other reasons, but have tested positive for COVID. In terms of the people who have been lost to COVID-19, 9 were in ICFs, 4 in supported living, 2 lived in their own home, 1 in a host home, and 1 in a rehab. And I don't have a breakdown at this time regarding the staff, but I think I can probably provide that next time. Yeah, I have it in front of me, but I don't have it broken down so that I could easily just read it out to people in terms of the staff. And the staff, just so people know, it is a variety of staff, including DSPs, nurses, a transportation person. So it's a variety of different staff. I think actually the transportation person wasn't working at the time because people aren't going anywhere right now, but they did report to us that the person had tested positive. Which, by the way, is something we're finding at DDS as well, and the importance for all of us about remembering all of the measures that we need to be taking to protect ourselves, you know, in terms of frequent hand washing, trying not to touch your face, keeping your distance from people, only going out when it's essential. At DDS, we've had staff who have tested positive since beginning to telework full-time. And so, you know, as we all know, this continues to be something that is at a point where what they refer to as community spread. And so it's important that people are very cautious in terms of how we're going about our daily lives.
For those of you on the phone that dialed in, we do have the option to text. So if you have a question, you can text that to 202-590-7618, 202-590-7618. What guidance is DDS giving to residential providers with respect to helping people request ballots and complete their voting for the June primary if they wish to participate?
You know, we haven't sent that out yet, and thank you for the reminder because we really do need to send it out. I thought of that as I logged on and sent mine in this week. And so it is essential that we get that done sooner rather than later because we do not want people. And we'll reach out to all of our providers today and provide them the information about how people in the district anyway, and we can look up Maryland. I know that in DC it's quite easy how you can request a ballot so that you can do a mail-in ballot for the June election. So thank you for that reminder, Carol. So I see follow-up questions about the issue regarding testing staff. I can just say that at DDS, we rely on guidance that's provided by the public health authorities in terms of testing. And as I said, I understand the issue of, that I think it could give people a sense of comfort for a day to know that a staff person had been tested and that, no one who tested positive was coming into work. But what that would require is to test people every single day, because it's a point in time. You don't know from that day to the next day where that DSP is after they leave work for the day. Even in instance, so that is the reason that is the guidance that we have at this time from DC Health. I'm cautious about stating any guidance too definitively, because as people learn more, as you know, guidance gets updated. But the guidance at this time is that people need to take all of the measures to prevent any possible transmission, to act as though you are already positive. The reason that we are required to wear face coverings when we go out is not because there's virus floating in the air and we're concerned about getting it. It is because we need to be cautious if we're within 6 feet of someone when we happen to be outside, that we may have this and not know it, or they may have it and not know it. And so the face covering is to keep us from sharing any of that with someone else. That at this time, those are the measures that are considered the most effective in making sure that there isn't transmission. Address.
How will DDS ensure people receiving Wednesday afternoon, the DC Hospital Association updated its guidance for hospital visitor restrictions for COVID-19 to expressly allow for a designated support person for patients with developmental disabilities. How will DDS ensure people receiving DDA services, their families, and DDA providers are aware of this policy change? How will DDS work with providers to ensure they are proactively identify staff willing to serve as a designated support person during a hospital visit or stay for a person they support?
So this is true. The Hospital Association updated their guidance, and we, as soon as it was updated, we did provide that. We shared that with all of our providers to make sure that they were aware. We shared it with all service coordinators and the nurse consultants so that they were aware, so that they can also share it with the families who may not have a provider. Keeping in mind that, so hospitals, I think people are generally aware, are pretty shut down right now. They are being extremely cautious about not having people come in who, like I said, you could be asymptomatic, so they don't want you coming in for that reason, but they also don't want people coming into contact with a person with COVID. So they are being very cautious. There was recognition by the DC Hospital Association that there are circumstances where a person with a developmental disability may require support from someone during their hospitalization in order to adequately access their health care. And in those circumstances, we need to make sure that that person can be available. People may know that in our Appendix K, it included provisions to ensure that providers could have a person with the person in the hospital when it's needed, and that there wouldn't be the restriction on, that they would be able to be paid for the services provided in that circumstance. This is not a new issue for our providers in terms of identifying particular people who have a need to have someone with them to help them through the process of hospitalization to help them with, adequately receiving the treatment when they're in the hospital. And the providers are well aware of who those people are. The whole reason for needing a person with them in the hospital is that it is a person who is familiar to them who can help make sure that any treatment can be administered because they have the familiar face, or that the person, accepts their meals because there's a familiar face there. And so our providers are well aware of the importance of this in certain circumstances and how to do it. And this question comes from Morgan, and perhaps we should have copied Morgan when we sent it out, just to let you know that we did advise our providers that Quality Trust could have advocates available should there be any questions about allowing this to occur. We, of course, told them they should call us, but we also did offer, because we had heard from Quality Trust, that they could be available to assist with this, so that if there are any questions when a person requires this kind of support, that they could get that assistance from you. And of course, from us, but we wanted to make sure that they knew they could get it either place.
Out of the 58 clients who has tested positive in supported living, how many have died?
I thought I had reviewed that before, but I can review it again. Of the people we have had who have passed in supported living, there have been 4. In ICF, there have been 9. In rehabs and host home, there's been 1 each. And people who live in their own home, there have been 2.
Any providers currently under investigation due to not protecting supported persons in their care from coronavirus?
So there are 2 different issues here, or 2 different sort of kinds of investigation. One would be with people we support, have there been any allegations that of neglect based on a provider not taking appropriate steps to ensure the person's protection? So, our providers not doing things that they're supposed to do. And in that case, I believe we have had none. In terms of, excuse me, we have had some instances where there have been questions about whether providers are properly implementing the plans that they had in place for operation during the emergency, and whether they're properly following the mayor's order. And in those cases, our first step is to reach out to the nurse consultant and the quality resource specialist assigned so that they can reach out, check in with the provider, see what steps they have been taking, whether they are in compliance, and whether there would be a need for a neglect referral, as well as whether there's need for more technical assistance and providing the technical assistance that's necessary.
What What requirements will DDS issue to allow supported living facilities to accept new residents, and when will they be issued?
There are no specific requirements for accepting new residents. If a person needs a placement, we are placing people who need those, but we're also taking steps to ensure that that person gets their choice of placement. And if they choose supported living, we are prepared and have supported people transitioning to supported living.
So a question from the provider is, how often should we be doing temperature checks?
So if you're talking about staff who are coming on duty, the mayor's order is very explicit, which is before anyone comes on duty, you should be checking their temperature. And for the people you support, you should be checking their temperature daily. And there was, for the providers, there was guidance that went out also around care of people who are in intermediate care facilities and residential habilitation placements that we posted on our website a week ago.
Yes.
And you might want to consult that because it gives very good information about, it's partly about conservation of personal protective equipment, but it gives very good information about what personal protective equipment is necessary when. So providers need to make sure that they're using the right equipment at the right times.
Okay, given the community spread, it does seem as though DDS would provide guidance with respect to minimizing outings in the community, for example, by bulk ordering and careful planning rather than last-minute piecemeal shopping. This is a suggestion.
I think it's a helpful suggestion. I do think, I mean, the challenge of the suggestion is the staff are then going home and living their lives. So while we can make recommendations about the things that occur while they're at the placement, we still have people who then, stop to shop on the way home. And I think some of this is also, I was a little concerned when I saw the beginning of your suggestion about minimizing outings. I think our guidance ought to be about ensuring safety during outings. For one, you don't take a group of people shopping, clearly. But we should be getting people out into the sunshine. We should be helping people, anyone who currently, because we still have our office open, because we receive mail, I have some staff who still come to this office. It feels only right to me if I expect a staff person to come in, I come in, and what I see on my drive home is that there are a lot of people out and about, walking, exercising, jogging, riding their bikes. People should be thinking about in their placements as a group, how can we safely get some exercise, get outside, feel good. I do think your suggestion about shopping, one would hope that they're already there. My experience with most of the providers is that they've been doing bulk shopping for quite a while because of the economies of it, but we certainly could send that suggestion to them.
So,
What proactive plans has DDA taken to stop the spread, especially in rehab homes and ICFs, where we are seeing the most deaths? Have you looked to what other states are doing? Has DDS provided any recommendations to providers regarding how to staff their homes in a way that minimizes the spread?
Yeah, we have staff who was on the NASD's webcast, the medical directors around the nation, and we are going to look at that data, compare it to what we are doing. And what we're doing is following the recommendations from DC Health with regard to people living in congregate settings. And right now, our nurses are calling and speaking to all of the provider nurses and getting updates on people who've been exposed, as well as people who've tested positive. As the director stated, there are a large number of people who have tested positive who are being monitored in their home, and we aren't seeing any challenges with that. They are using universal precautions. We're checking on PPE that people are using and needing and keeping up with that. We have the QRS staff who are reaching out weekly to discuss with providers and providing guidance where necessary. We are fortunate to have many qualified professionals working in our ICFs and ResHabs who understand how to support people during public health emergencies. However, if they don't know, if they need help, we're in their ear. They're in our ear. We're constantly in contact with these people.
And if I could just add the other thing recently, you know, we, as we've said before, and continues to be true, I think Winslow talks at least once every single day to DC Health. We are constantly in communication with DC Health. Their guidance was updated last week regarding the ability to test people. There is recognition by DC Health, and they can of the higher risk to people who are in these settings, and they continue to work with us on coming up with other ways that we could reduce the risk to these people.
Are there any other questions? Please type in our chat box, or you can text us at 202-590-7618.
I do see a question up above. It looks more like a suggestion than a question, but it says, how about not having people who are positive not coming to work? So providers are required to give us information about anyone who tests positive. We share that information with DC Health. We coordinate with DC Health so that we're aware of any people who work for providers who may be positive. DC Health then does have their epidemiology staff. That's the staff who are responsible for limiting the spread of the illness. Reach out to a person who has tested positive to make sure that they are taking the necessary steps. We have required all of our providers to provide the lists of all their current employees so that we know when employees work at more than one agency, so that if one agency learns they test positive and reports it to us, we are able to ensure that DC Health takes the necessary steps to ensure that that person is not going to work somewhere else.
On future calls, would you consider selecting one or two of the obvious burning issues and addressing those at the top of the hour before taking Q&As?
I'll just say great minds think alike. So I was actually this week thinking about that, especially because on our provider call today, we have so many updates that I had said to a couple people here that they need to start the call by providing those updates in the call. So I think that's a really good suggestion for this call as well. And maybe what we can say to folks is, you know, if you have suggestions about what that sort of presentation at the beginning should be, let us know. But I do think that is a really good idea because, you know, as we go, it's not just answering questions, but also giving out information and making sure. I think it's important that we're doing that also so that people can recognize everything that is happening and that we can sort of communicate what those burning issues are and how we're dealing with them. Because for those of us who are in the middle of this, dealing with it day to day, I will confess that at times we don't do as good a job of letting people know all of the information that we are gathering and dealing with each day, and that is what these calls are supposed to be about. So that's a great suggestion, and we'll make sure that we start next week with that.
Will you take input before the call on what burning issues stakeholders would like you to address?
Absolutely. Yeah. You may have typed that before I said it, but absolutely. So when people have suggestions about what burning issues we should address, you know, please submit them along with any questions you have. Because I know that right now, as I say, for the provider call, we have a number of things we want to talk about today, about testing, about our Appendix K, our monitoring, and so I do think that for this call we should be thinking about the same thing.
There are many reports from around the country of inadequate PPEs for direct support professionals and others providing person-to-person support for those with IDD. What is the situation in DC? Do providers have enough equipment?
So we always, on our provider call, have someone from DC Health, from Health Emergency Preparedness and Response Administration, who is responsible, who works directly with all of our providers. Providers have given them the inventory of what they have and what their needs are, and works with them to make sure that as they need PPE, it's available to them. Our quality resource specialists reach out weekly to providers to check in with them about the adequacy of their supplies. We do hear concerns from providers about the adequacy. Generally, what it has worked out to, it seems to me, from when we follow up to look into it, has been that a provider is expressing concern that they don't have enough on hand for what their needs will be. And those providers who are expressing that concern, that's great because they're wanting to plan ahead. But HEPRA, Health Emergency Preparedness and Response Administration, prioritizes current day provider needs in terms of PPE, but also hears from them what their future needs are and is doing their very best, and to date, I think, doing well at making sure that providers do have what they need. But they continue, anyone that watches the news knows that this is a struggle across the country. I will also give kudos to our provider coalition that got together and did an order together so that they could have some more supplies available to them outside what the district provides through DC Health. So it is now 11 o'clock, and I know that the mayor has a press briefing at 11 o'clock, and I want to make sure that people have the opportunity to listen to that. Thanks for your questions and your suggestions today, and I will talk to you next week.